to Born for This Stories, where we speak the truths no one told us, so you don't have to carry this alone. On today's episode, we are covering what no one tells you about pediatric surgery recovery. There's so much build up to that surgery day or those surgery days, depending on what you're going through. But what is not really talked about or focused on is what happens after you get your child home. And at least not in the way that it needs to be. Like, I definitely don't want to say that we didn't get post-op instructions. Of course we did. But the true, hard reality of what is needed past those post-op is probably just as important, in my opinion, as how to care for your child when you get them home.
I don't know if it's on purpose or not, but it seems that doctors, they're so used to doing it that to a patient and a caregiver, everything is kind of downplayed. When you're actually in it, at least for me, everything seems so much more intense than the spiels that you get before the operation. Oh, this is what it's going to look like. This is how you're going to take care of it. They're going to be on medication, so it's not going to hurt them. And then when you're actually in it, you're like, this is a little bit worse than I thought it was going to be.
It also reminds me when you get those post-op instructions, at least for us, because they had to sit down. It was on an iPad. You had to watch it. But side note, if anyone from that company ever listens to this, they should just let you airdrop it to your phone, because I'm trying to take notes. And of course you get a paper copy, but when you're at home with your child, trying to remember all the things that they went through post-op and to make sure that you don't mess it up, you're not pause, angry child that wants me to change their diaper, that now I have to be extremely careful. I need to go read this page of notes to make sure that I don't mess this up. So it's almost like you're being sat down and read this information super fast. It's and by the way, in 5 minutes, you're going to take a test on this and I hope you pass and get an A. It does get easier, right? Because every time you do things, you make a new memory and a pathway, and the more you do things, the better that you get at them. But even with that being said, even though the post-op information is available and it's good, it's just so much, and you're so nervous and on edge when you get that child home that you're I don't want to hurt my child. I don't want to mess this up. I don't want to mess up a way that they can heal. And so just that weight on your shoulders is huge as well. And then the whole other part of it of the things that they don't prep you for post-op is just overwhelming to an extent.
It was almost like when we brought our first child home. I remember putting him in the car to take him home and thinking, what do we do with this thing? And I'm scared to drive all of a sudden and all that. When we got our second child out of surgery for the first time, you put him in the car and you're like, what am I in for? It was kind of a similar feeling for me, at least.
Yeah, that is a good comparison, because I also remember when we brought our first son home, we were driving and people are walking their dogs and they're jogging. And I'm like, man, these people's lives haven't even changed at all. And here in our world, our lives have changed 100%. And I felt that way after going through the surgeries with our youngest, because we traveled, as you guys know. So we traveled from Florida to Texas. And because of his condition, most people outwardly, looking at him, did not even know that he had just had a massive surgery. So the stress that I was carrying, that they probably could see on my face, was probably why? But also you're in the plane and you're having to change diapers and work around catheters and wounds and stuff. And there's just again, our world had changed drastically, but from an outsider looking in, no one really knew. And this is also a little plug on why you should just kind of always try to be nice to people, because you don't know what people are either going through in that moment or what they have been going through. So it's just, easier to just be nice and don't judge. I also, on a side note, remember being on the plane one time, having to change Silas's diaper right after surgery. And I'm trying to do my best. And the flight attendant asked if I put his diaper in the trash of the bathroom, which I did, because where else would I put it? So I told her yes. And she goes, oh, can you take that out of there? I just changed the trash bag. And I'm like, no, I cannot do, like, that's where I'm going back to like being nice to people, because I was like, no, I'm not taking, like, I wanted to go off on her, but like, no, I'm not taking the diaper of my child who just had surgery that I had to change the diaper on the plane out of the trash can in the bathroom. You don't even know what I went through. I did not do that because I'm typically not triggered like that to strangers, but I just told her no, which is actually pretty hard for me to do and validating in that moment. Anyway, so there you go. Little tangent on that. So that was like some of the things that we went through getting him home. And, to like those first rides are just crazy anyway, because they're still sedated. You take them back to wherever you're going, your Airbnb, your house, and you have a sigh like of relief, for lack of better terms, because you're like, okay, we've made it through the procedure and we're able to go home. But then that's where like the true healing starts and begins, and the true work begins for the family, right? Like the surgeons did their job. They're all good. And then the families have to take over, and it can be a lot, especially when you've never been through it before. So we see you. I would say the first 48 hours post-op would be like the most intense and the most extreme. So with that being said, like for us, a couple of things it worked for us. It's not going to work for everyone. Like at the time, our son loved the song You Are My Sunshine. And I remember being up at all hours of the night after his surgery, holding him in the bathroom, just singing this song to him to soothe him, to bring any type of normalcy and balance to help make him feel better. And I would do it 10 times over. It was obviously exhausting. It was hard to sleep during that time because you're just hyper vigilant on like, are they okay? Like, what does this cry mean? Is this a cry because he's young, or they're young and they're just upset because they're waking up? Is this a cry because they're in pain? Is this a cry because there's something wrong? And you have to kind of sit in those moments and see how long it goes on for and try to figure out. And then feeling alone in that time. Like, of course, the surgeons were great at the post-op care and like the technical stuff, but then that's where I talk about like, then you get home and you're like, woo, like I don't have a lifeline. Like I can't like text them and be like, hey, this is what's going on. Is this, a problem? Is this a normal thing? And then you jump on the internet, which is like so overwhelming, and you're probably still not getting the answer that you need. So just kind of be aware, and like we hear you, we see you in those first 48 hours. It's intense. It's a lot. The best thing I think is like finding things like this podcast that can help you navigate and think about some different ways to support your child from coming off the anesthesia, but also just hearing other stories so you can gain some knowledge on like what to expect is like super helpful. Because through we had 3 different surgeries. Through those 3 different surgeries, our son responded 3 different ways within those first 48 hours each and every time. So it's almost like, okay, I thought I had it figured out the first time, but then the second time it was different. And then the third time it was different. So it may not always be the same, but to have a nice little toolbox of knowledge can be super helpful in helping you navigate that space, probably at a time that like there is no one available. Like you're up at midnight, you're up at 2 a.m. Like, who are you going to call? Who are you going to reach out to get those answers from?
Well, and when it's your child, you're a lot more likely to feel it. This is an emergency, or this could turn into an emergency at any moment. And you make that happen in your head because you don't have the answers right by texting somebody very quickly at the clinic or wherever they had the surgery or whatever. But ultimately, what we learned was that even if it gets worse for a period of time, we knew the medications were in there. We knew we were doing the right things. It was just our minds that were freaking us out. And it's your most important thing in your life is your child. So
yeah,
quick to freak out in our heads, but ultimately, typically everything's going to be all right. You just have to get through it. And I know that after one of the surgeries, I'm not sure which one it was, he was just kind of laying there, would start to scream, and it was not a tantrum. It was not a normal child scream. It was a scream with a kicking, like you could tell he was in pain. And what do you do? Like, we didn't know if it was internal. We didn't know if it was external. We didn't know what to do. And then it passed and things were fine, but there's no quick fix to anything. And when you know you can't get a hold of anyone right away, it's even scarier.
For sure. I mean, it's what I would like to term like the emotional whiplash of it all, because you're living it. So you're like, you're okay 1 minute, and then the next minute you're not okay, and then you're okay the next minute. And it's just like these extreme highs and lows, at least really through that first like 48-hour period. And then for us, I think it's kind of reset too, because after those first 48 hours, then we flew back to Florida, and then you were back in your home. But the whole time you're flying and you're holding your child and you're hoping you don't mess up their dressings and different things, like there's just all of this other like emotional stress and baggage that comes alongside with that. And, I think that, like you said, like some of these things would pass and you would feel better, but then like still in the back of your mind, you're like, did I make that right choice? Like, should I have like given them more pain medication, or should I have like done X, Y, and Z? And this is where, just being like, taking a moment, I think, and also taking a deep breath. It's so easy just to go right into reaction mode and like fix. But sometimes we just need to center ourselves and think, okay, this is a really hard moment right now, but how do we navigate this and make sure that we're making the right decision to just help promote the proper healing process that they're going through, because they're going to be uncomfortable. Like, that's just like the reality of it, depending on like what type of procedure they're having, like they're going to be uncomfortable for multiple types of reasons.
And you're going to cause that uncomfort sometimes, which is even worse for you when you pick them up wrong, or you're changing a dressing or something, and you caused the pain that wasn't there. But that's just a part of healing. And
you definitely think that like the hardest part is over when the procedure or the surgery is over, but that's just, you just conquered one mountain, right? And then you have to come into your home care and taking care of them and their recovery, and that's its whole other mountain. And you just got to start back at the bottom and work your way back up. I would say that like one of the biggest things that happens with these types of procedures, like for the child and even for the caregiver, is that it really puts your nervous system into like overload, into fight or flight. And that's where I think most people are spending their time anyway, with getting this diagnosis, navigating the care for their child, and kind of trying to work through the emotional process of themselves as the caregiver, and the guilt that comes with it, and all of those things. And it really, it's hitting you from a physical standpoint, an emotional standpoint, and a neurological standpoint, because that neurology is what puts you into that fight or flight. And we can typically see different types of regressions that can happen in children during this time. I would say, thankfully, like we didn't notice that as much in our case. Like everything seemed to move forward at the pace that it should have been. But there were definitely, there was just the unknown too, because our son was so young. He wasn't doing things that you could check off the box of like, yeah, he has, he's been walking or potty trained and now he's not doing it. Like, we did first surgery before he was even crawling. We did second surgery before he was walking or really talking. And then we did the third surgery as his brain was really developing. He was starting to come into like vocabulary and words. So each time it was like right before he was supposed to hit those milestones. So there was always in the back of my mind, like, is the anesthesia going to cause a problem? Because of course, like there's pros and cons to everything, right? There's pros and cons to medication, to procedures, to everything in life. And as much as we want to put all of our faith in the medical side and say there's no contraindications to that, like that's not reality. And to have such a young child under anesthesia so many times in such a technically a small period of time, I was really, really concerned that it was going to affect his mental capacity and just like either slow him down, or he may not even like get to the point where he was originally going to be if we didn't, provide those procedures for him. But that wasn't the reality. Like, we had to do those things. But thankfully in our case, that didn't seem to have that type of an effect. So I'm very thankful for that there was no really regressions and milestones. But the pain management overall was definitely a struggle.
Yeah, and one of the things I had read at one point, and I don't know if it's true or not, but it's all the stuff that goes through your head was that if you give your child Tylenol within the first 12 or 18 months of their life, they're 20% more likely to develop autism. I don't know if that's true, but that goes back to Googling things and doing your research, which a lot of it's good, but it can really scare a parent too, because you see that some of the crazier things that may not be true, you see some of the crazy things that are true. You don't really know which is which. Like I said, I don't know if that statistic was right or wrong or crazy, but it was still enough to be really scary.
Yeah. And you can't, being on the holistic side, I mean, we want to do everything as much as possible to not put things into our son's body that didn't need to be there, that could affect things, but you can't do just some arnica, for lack of better terms, when they're having this type of surgery. Like, you need legitimate, like, pain management, and you need to stay on top of it, because if anyone's ever had significant amount of pain, like post-op, or like, I mean, even if you think about getting your wisdom teeth removed, if you don't stay on top of that medication and that pain gets away from you, it's hard to backtrack and get you back out of the pain. But if you stay on the frequency that is recommended of the pain meds, then it is better to manage. And for us, like, then I personally struggle with, do we continue on giving him the medication at this frequency, or is it time to actually back off? Because you never want your child to be uncomfortable.
Yeah, you never want them to be uncomfortable, but we're always less is more. Like,
right.
Back off as soon as you can, but
we also were traveling on those days. So that was difficult too, is I didn't want to be traveling on a day we were decreasing his pain meds and then get to a point that we're up in the air and we can't help him. So we did make the decision to just continue on with that protocol through getting home, and then we weaned him off. And overall, by that time, he seemed to do just fine with it. I mean, the good thing is like, kids' bodies are young and they are resilient and heal usually a lot faster than adults do.
Yeah, and backing up to that is, you can't communicate with a kid that age. So they can't tell you, hey, I'm starting to feel something, it's starting to feel off, or they're so distracted because they're kids and they're doing all kinds of crazy things.
Yeah.
They can't tell you, hey, I think I'm starting to feel something, I think I need a dose. And in fact, they're typically spitting out the medication or choking on it or getting it out of their mouth as fast as possible, and you have to pin them down and wrestle them just to get it in, and you don't actually know how much goes in, and you don't want to overdo it if you don't think much went in. But yeah, it's fun. It's a struggle.
Totally fun. So, of course, like, I think then the next part is like, you're always concerned with, I don't want to touch them wrong, because of course, after having some sort of procedure, there's going to be handling of the wound and gauze and whatever.
In our case, a
catheter possibly, and creams and things like that. And I mean, even you just never want to hurt your child. When we're helping them recover from this stuff, we never want to intentionally, like, accidentally, like, put a gauze down too soon and it hurts or something like that. And I mean, of course, everything right fresh post-op is more tender, more sensitive. I think the hardest part when we're talking about like having these children go through these different procedures is that they're children, right? Like, either for us, like super young, they can't even communicate, they don't even have words yet, or even in some people's instances, their child is older and can communicate, but they can't rationalize the things that they're going through. And so you just try your best, you just try the best that you can and try to have support and backup. Is always easier for us, since we were dealing with like the wound down below and it affected diaper changes. Always easier for us to have two people changing diapers. When we had to do it one, especially in the beginning, right as the procedure happened, it was hard. It was very difficult. But the further you get past and the more healing that happens, it did get easier where you could drop it down to one person. But that was really hard. And I mean, honestly, that last surgery, like the first two surgeries for us, he had the same type of catheter, a Foley, which is like a balloon inside, which was so much better. I understand why they couldn't do this, because you had actually deflate the balloon to get it out. The third surgery, because of the way the procedure was set up, He had a different type of catheter. It didn't have a balloon to hold it on the inside. And that was the one time we did have to hit that help button and call those surgeons after hours because that catheter was just about out. And he was in extreme discomfort. I was freaking out because it was supposed to be in for 14 days and we were at maybe day 6. We weren't even halfway through the length of time. And I was so scared that we were going to have to turn right back around and go to Texas or wait another 6 months to have it done again. I mean, my brain was going a million places. It was not good to be in. And when all I could do until that 6:00 p.m. time hit is I could email the nurses and they're telling me it's fine. And I'm like, I know it's not fine. So I'm just counting down the minutes until 6:00 and 1 second hit. And I got right on that line, got right a hold of one of the surgeons. They kind of walked me through it and she's like, yeah, just take the catheter out. It's basically out anyway. I think if we would have waited and we would not have called them, it would have been out by the next day. And it would have been highly uncomfortable because it was being held in by a stitch, which is why it was uncomfortable because it kept pulling skin.
I know when I pulled on the catheter, it was barely in. I mean, it was like a centimeter or two in still and everything else had come out. So you were right and you knew it. And
so also like trust your gut, parents. Like if you just know something doesn't feel right, like that's always going to we're always going to re-anchor back to you. Like always trust your gut. If it doesn't feel right, like be that squeaky wheel, be pushy. It's your kid, or your loved one. Like make sure that if you have a question that you don't need answers and they're not taking you seriously, like honk the horn, like get in front of whoever you need to get in front of to make sure that everything's okay and that they don't need to have like something else done. And it was hard for me to actually use the I call it the emergency line. I don't really know what they call it, but like the after hours, doctor's line. It was hard for me to do that. Like we were already home. I wanted to respect the doctor's time. I come from a medical profession. Like I didn't want to contact them after hours and bother their family time, but I could just tell my gut something wasn't right and that this needed to be handled and addressed. So always trust your gut, always know. And always know too, you're not going to do everything 100% perfect. I should have been paying attention. I should have known that catheter was coming out. I should have known. But I had another kid too that I was trying to take care of, plus all the daily things of life. And it just never occurred to me until it was too late. And I mean, everything,
But that was also surgery number 3. And nothing really did go wrong on the other ones, and you had no way of knowing really other than your gut, and that's what happened, and it worked out. And that's ultimately what that quote unquote emergency line is there for. Even though it's uncomfortable, nobody wants to bother somebody after hours. Nobody wants to do that. That's what it's there for. And the doctors and practitioners and people that answer that, they're there for a reason, and they expect that once in a while. I'm sure we were not the only ones to do it, and even though it's uncomfortable, you have to when you know it's the time.
Yeah, for sure. So we definitely want to also hear more from you guys on some of your gut stories and how you manage and handle that and what to expect. But I think just overall, as far as going back on what we wish we knew, I just think that you have to just be patient with yourself, be patient with the healing process. I would always, without this being medical advice, stay on top of the recommendation that your provider provides for you regarding medication and pain management. Because again, once it gets ahead of you're behind, it's hard to get back on top of it. You may not do everything right. You may cause a little bit discomfort, but you're doing the best that you can with those wounds. Just try your best and as far as that goes. And we did do some other things, some homeopathic things and stuff that we're going to talk more about in a later episode. I don't want to dive too much into it because it deserves its whole own episode on the products that we use and the companies and things to just help promote. Because we did have to give him pain meds at such a young age, and we did have to give him anesthesia 3 times in the first 18 months of his life. And at least from this holistic side, that stuff builds up in your body. So how can we open up those pathways and get those things moving so we can have the benefits of them without hopefully some of the side effects. So I want to dive all into a different episode because again, it deserves its own space for sure.
Did you notice anything again with our older one when we were going through that? I know we touched on that on the previous episode, but did anything pop up in your head about any changes or different behaviors or anything that you think was bothering our other child?
That's a good question because I think when we talked about the regression, that can happen in the actual child itself that's having these procedures done depending on their age. But when there's siblings around too, this is common when a a mom is pregnant and they go to have their next child, but their older child can regress. Again, like we're here to like talk about our experience and our truth, and we never want to exaggerate on something or say something that's not true. Like really, like I didn't notice any regressions in our oldest, like, and so that's good, like
Yeah, he seemed to just kind of go with the flow.
Yeah. He did. And we did talk. I mean, everyone has to do what's right for them. And again, like I'm looking forward to hearing more stories from other people, but like we talked to him to an extent what was going on. I mean, we didn't get into the nitty-gritty detail because there's really no need to, because I mean, he just doesn't get it on that level. And we will continue to navigate that space as they do both get older and their bodies change and all that. But we we were upfront with him about some of the stuff that was going on and what Silas had to go through, and he just I mean, we're blessed. Like he fell in love with his brother the second that he held him, like, and yes, they're kids and they fight, but like they're really good and close and cool buds, so I don't think that means that there wouldn't be any type of like animosity or regressions that happen, but like for us it just wasn't a thing. So, but I'm sure it will be for others, and we want to support you through that and hear your stories. I definitely feel like on the other side, there is definitely some lingering PTSD, at least from a parental, like caregiver perspective. What do you feel about that?
Definitely. I mean, I think we're still looking closely at things and making sure everything looks normal and making sure he's growing. And we still have feelings of when he's 9 years old, did everything grow? Did everything stretch the right ways? Did it all pan out the way we hope it does? And I don't think that's going to completely go away. It's certainly not like the forefront of my day or anything I constantly worry about. But when he's showering or doing his thing, I mean, we're paying attention. We're making sure everything's still normal. And I don't know that that'll ever really go away until he's a lot older.
I don't think it'll ever go away, especially being someone that is a medical provider in a holistic space and working with other like providers similar to that. Like for me as a mom, there's lingering PTSD because I'm hyper vigilant on like, for our case with hypospadias, like, is everything looking good? Is it working right? Are we missing anything? Like, are the most common, like, things that could happen to require resurgery occurring? Like, we need to be tracking these things, but how do I do this without making Silas feel like I'm overbearing and being weird or anything like that? And then also, like, just knowing how the body works and tissue and scar tissue and how his body may change over time. Like, is he going to need anything, like, additional, like, pelvic floor physical therapy because they are working on that area, and like how am I going to explain that to my child? So there is a lot that goes on in my brain, and I just share that because I think that's going to be a lot that goes on in some other caregivers' brains too. So like you're not alone. Like there's that constant just like spinning in that hamster wheel of X, Y, and Z, and also like how to keep that more so to myself versus projecting it on my child, and figuring like, obviously we have to just handle these things as they come, but no, my brain never stops about this stuff. And I can now look at him and see him as him, like as just who he is and who he's becoming and all that. So I'm very thankful for that, because for a while, especially when we were going through the surgeries, it was just so focused on the wound, the repair, how does it look, envisioning like, will this ever be normal? Like all of those things. So I am thankful now that like I have been able to get past that and really focus on him as an individual versus him as a condition. And that sounds horrible, but I'm only saying it because like I know I'm not the only one that feels that way. And it is like, you're not alone. Like to sit there and look at your child as a condition is very common as you're going through this. And I hope that we can provide the space and support that you can also, if you're struggling on that line, that you can learn how to see them as who they are as well. Nothing's linear in healing. Let's just say that. It's always up and down. So, we did this for 18 months. And there was tons and ups and downs through that process. There were tons of times talking myself off the ledge that like everything was okay and everything was going to be okay, because at least with some of the research that we did and with Silas's condition of hypospadias, there was a lot of talk, negative talk, in the groups about needing multiple surgeries because because the first surgeon that was being used didn't maybe do it the most accurate or proper way. Like, I hate to say that because I mean, they do what they do, but there's lots of talk about needing multiple surgeries to fix what had happened from a previous surgery. And that's one reason we made the decision to choose the surgeons that we did, because they were fixing these other scenarios, is to help to avoid that. But you go through the healing process and you go back into like, oh my gosh, I don't want to mess my kid up because I don't want to be the reason that they have to go back and have an additional surgery. So just trying to, again, just like take a deep breath. Nothing's linear. Healing will take time. It'll be an up and down road, but it doesn't mean that you're not doing the right things.
Yeah. And for us, the part I didn't like is that once we felt like we were healed or it wasn't the forefront of our day every day and we were there, we were like, okay, couple weeks and
we get an email
and we're
scheduling
and we're doing pre-op stuff and talking to doctors and getting ready and booking trips, and we were right back in it.
Yeah, for sure. So you are not alone in this space. We definitely see you and feel for you, and it can be very difficult. It can be isolating. A lot of people feel like they don't have a support community to talk to, and that's why we are here. We're here to be your support. We're here to lift you guys up and provide you with any of the support that you may need, or even be like that late night touch point that you need as you're sitting in that chair. And I mean, listen, there's tons of nights I spent in my toddler's bed sleeping with Silas because he couldn't sleep on his own coming off that anesthesia. And so if that's you, like, don't feel alone per se. Like, we've been there. We're there for you. That's what this podcast is about. And it's going to feel like too much at times, but we got you. We're here. You're not alone.
Thanks again for tuning in this week. Share this episode with a friend. Leave a review if it helped you. DM us your story. We'd love to hear from you, and tag us so that we can hold a space for you too. Check out bornforthisstories.com and stay in touch.
We'll see you next week.